babies eat, sleep, poop, pee, and cry, and they should do those things vigorously. And that's their only means of communication. And it's also normal for babies to cry 2 to 4 hours a day. They're exercising their vocal cords. Think of the babies as talking or singing in that form. So as long as if the baby's crying and it's time to feed, you fed the baby. If the baby is wet or soiled and you change the diaper, then it's okay for babies to cry, as long as you know the baby's not hungry, dirty, or wet.
Well, I think it's important that we help teach parents to learn how to identify the different types of cries. Because as you get to know your baby, you'll identify the cry.
After a few weeks, you usually can tell what they're communicating through the different crying. Sometimes it's just and we try to pick up on, especially when they're hungry, early feeding cues. By the time that they are screaming, they are so overly hungry, they feel like they are going to die. And so when we try to feed them, they don't eat well, they don't nurse well. Other times, maybe they are making noises because they're uncomfortable. If they bump their head, if somebody doesn't pass them the right way, you can just sometimes pick up on the crying that comes not because they're hungry, not because they're wet, but because they're frustrated.
I'm really not for letting a baby cry, especially in the infant stages. The first 2-3 months, we like to say that you can't really spoil a baby. So I encourage you to hug that baby, hold the baby, nurture the baby.
So I always encourage parents, especially in those first couple of weeks after birth, to just spend time holding your baby. That's all that they want. We need to be able to mimic the womb as much as possible, because human babies are the only mammals that are born after 9 months instead of 12. So other mammals are born in this world ready to go, whereas our babies aren't. They still need that 3 months. We call that fourth trimester. So when parents can give themselves that opportunity to just be for their child, to just exist for their child.
Shaken baby syndrome is something that's inflicted upon an infant. Generally, we're talking about probably more a child, if we're going to categorize it, at least 1 year and under. We're talking about a very weak neck and a very large head, and mostly the motion is a back and forth one. So it's a violent inflicted injury, something that happens to a child if they're shaken by a parent or someone, or adult, or maybe from a fall. People think, oh, my baby laughs when I maybe throw them in the air. Again, you're thinking about that's an accidental, violent thing that you're doing to your baby, causing that weak neck and that large head to slosh back and forth. There could be vomiting, there could be loss of sensorium in terms of person, place, and time. And of course, a lot of people would wonder, well, a baby can't tell you about person, place, and time, but you notice that their parents know their children, and they know that they're not acting appropriately. Also, maybe you might notice that there's something occurring with the eyes in terms of looking at the white part of the eye. There could be a bleeding if it's violent enough, because we're talking about damages to the brain and or eyes. That babies always know when you're the most tired, and that may be the time they cry the most. That's when you need to use that support system. Maybe it's your husband or your partner or family or friends that can come over and say, you know, I'm kind of at my wit's end. I need some help. Because the longer that baby cries, the more your patience gets shorter. And you're probably going to be at greater risk, even though you always said, I'll never hurt my baby. But there's always that one chance that you just get so frustrated and you just throw the baby up in the air, or maybe you accidentally just put the baby back in their crib, but you do it a little bit more violent than you planned to, and that's when accidents can erupt. So to stop that, you need to make sure that you pretty much have, and I think it's a really good gift to give new parents. It's like a schedule of people who are available during the day or during the night that can help you out.
When we're nursing especially, we're bringing about the hormones, the oxytocin, the endorphin. Your baby's making endorphins. That's the nature's happy pills. That is nature's way of calming mom's anxiety, calming baby's anxiety. So when baby's frustrated, so is mom. But when mom is frustrated, so is baby. So I think, again, it's taking a back seat, letting this baby set the tone, giving them what they're needing when they're communicating it, rather than training them to cry it out or getting them to get into this routine. It's just really not what they're set up to do. So if we can bring them into this world the way that nature best asked us to do, we find that they do well, they adjust well, and they're very socially well adjusted as they get older.